Hello, everyone. Let's do a quick sound check. If you can hear me, please type yes in the chat box. All right, it looks like a lot of you can hear me, so let's take care of some housekeeping information before we dig into the substance of this presentation. If you have any comments, questions, or concerns about technical or other issues during the presentation, please go ahead and enter them in the chat box that you've just been using to inform me that you can hear. And then if you have questions for the presenters about their presentation, please put them in the Q&A box, which is separate from the chat. So on my screen, along the bottom, there's several icons, and the Q&A box has two little speech bubbles next to each other. And then the chat has just one larger speech bubble. So use the chat for any technical issues or other kind of questions and concerns. And then if you have a question specifically for the presenter about the presentation, put that in the Q&A box. Here are some answers to some commonly asked questions. Yes, we will be recording this webinar, and the recording will be available on the CADCA website following the webinar. And yes, I will send out a copy of the slides to everyone who participated following the webinar. And CADCA provides a letter of participation for attendees, and I will provide you with more details about how to get that letter at the end of the presentation. And finally, I'd like to put in a quick word for CADCA's annual survey. This year's survey launched in January, and CADCA encourages all coalitions to fill it out. We really value the information you provide as it helps us tailor our trainings and other resources to your needs as coalitions. If you complete the survey by May 27th, you'll be entered for an opportunity to win a Visa gift card. So email survey@cadca.org to find out more and get your survey link. Welcome everyone to the latest installment of CADCA's Research into Action webinar series. I'm Carolina Duth, and I'm a member of CADCA's Evaluation and Research team. If you haven't participated previously in one of our webinars, the purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. I'm joined for this installment by Brittany Bugbee of the University of Maryland School of Public Health. She will present on the findings of her article, Substance Use, Academic Performance, and Academic Engagement Among High School Seniors, published in Journal of School Health in 2019, and discuss the effects of youth substance use on the odds of skipping school or of having low grades. And now I'd like to introduce our presenter, Brittany Bugbee. Brittany is a faculty specialist with the Center on Young Adult Health and Development at the University of Maryland School of Public Health, where she also received her bachelor's and master's degrees in community health. Her research interests include substance use among adolescents and young adults, collegiate recovery communities, and understanding the relationship between health and academic performance. And now I'll turn it over to Ms. Bugbee to discuss her work.
All right. Good afternoon, and thank you to CADCA and to Carolina for having me today. As Carolina said, today I'll be presenting my work. Oh, I'm so sorry. I think I just unshared my screen. There we go. All right, I'm sorry about that. Today I'll be presenting my work, which examined the relationship between substance use, academic performance among high school seniors. All right, so this paper, as Carolina said, was published in the Journal of School Health last year. I have a link here, go.umd.edu/Bugbee. If you'd like to access the article, that link will take you to access the paper for free. And while I'm on this slide, I also just wanted to take a minute to acknowledge my co-authors, Ken Beck, Craig Fryer, and Amelia Aria. They're colleagues here at the University of Maryland School of Public Health. The work I'm presenting today was actually based on my master's thesis, and my co-authors here were my faculty committee members during that process. So I just want to thank them for their guidance and for their help with this research project. All right, so to start, I'm going to give you guys a little bit of a background about how this research project came to be. So this figure here that I'm showing you uses data from a national study called Monitoring the Future. For high school seniors, you can see here, the good news is that there has been some movement in substance use numbers among high school seniors during the past 2 decades. So this here is showing 1999 to 2018. This is showing lifetime use. So it's saying by senior year of high school, had these students ever tried alcohol, cigarettes, or marijuana? In 2018, 59% of the seniors had ever tried alcohol, which was down from about 80% in 1999. There was even greater change in smoking cigarettes, which decreased from 65% in 1999 to about 24% in 2018. Although marijuana use has been roughly stable throughout that time period, the data suggests that alcohol use is starting later in life than before, and especially in the case of cigarettes, probably just happening less overall. So those data that I just showed actually inspired another group of researchers to look at what percent of adolescents were abstaining completely from substance use. No alcohol use, no tobacco, no use of other drugs, complete abstinence. So this figure comes from an article that was published in Pediatrics in 2018. The authors used the same study as the previous slide. So again, this is nationally representative data, and they looked all the way back to 1976 to look at whether or not there were changes in the proportion of students who were completely abstaining from substance use. And as you can see, the percent of high school seniors, that's the thicker, darker line at the bottom, the percent who had completely abstained from substance use has gone up from about 6% at the start of the study in 1976, all the way up to about 26% in 2014. And that change is even steeper for 10th and 8th graders. That's largely driven by the changes in alcohol and cigarette use that I showed on the previous slide. The study that this figure comes from is actually a pretty unique study in the realm of adolescent substance use. In research, there tends to be a focus on reporting individual substances, like just looking at alcohol numbers or just looking at cigarette numbers. It's less common to focus on abstinence from all of these substances or to look at how they overlap with each other. It's kind of two sides of the same coin, but it's a slightly different lens to focus on abstinence, promoting abstinence from all substances rather than focusing on reducing substance use. So this study here that I'm showing was in some ways a pretty unique one. For this audience, I probably don't need to tell you that substance use is associated with a multitude of negative consequences in adolescence. And that includes our focus today, which is academic outcomes and academic behaviors. Some key outcomes that have been linked to substance use in adolescence include lower grades in school, less time spent on studying, and also lower on-time graduation rates. Often a question that comes up here is kind of a classic chicken or the egg question, I like to call it. Which comes first? Some researchers tend to lean towards the idea that decreased academic engagement or performance comes first. So from that perspective, as an adolescent disengages from school, the risk for them to begin using substances increases. If that feeling of engagement is missing at school, the adolescents can begin to seek that feeling of engagement or fulfillment somewhere else. And for some adolescents, that somewhere else can be substance use. On the flip side, other researchers lean towards the idea that as an adolescent begins to use substances, they then begin to pull away from school. One piece of that idea is that substance use, especially as it becomes more serious, can really affect the reward pathways in the brain. The brain begins to have more trouble balancing short-term rewards and long-term rewards. Academics are generally a long-term reward. So for example, getting good enough grades to get into a college that you really want to go to, that's a long-term reward. By comparison, the feeling you get when you use a substance is a very, very strong, short-term, often positive feeling. So as an adolescent becomes more involved in substance use, the brain can start to prioritize that strong, immediate, positive feeling, whereas motivation for the long-term payoffs can decrease. And also substance use can cause changes to cognition, things like memory, attention, those things that are crucial to academic success are impaired. So balancing those two kind of different ideas about what's happening here, I tend to think that the answer to that question is probably somewhere in the middle. For some kids, the substance use comes first. For other kids, the academic engagement comes first. And for other kids, it could even be a mix of both happening at the same time, which is why I have a cycle diagram here. I think they probably can feed into each other quite a bit. The research I'm going to show today comes from the perspective that the substance use occurs first. But I just wanted to acknowledge up front that that's probably not the only way this is all related to each other. It's not the only way this could all happen. One really interesting idea for research in the future would be to look at the same question I have here today, but from the other perspective. And that would probably be interesting and as formative as well. So today we're just going to look at this as if the as if the substance use is preceding the changes in academic performance. All right, also I keep mentioning academic engagement. That's a really key piece of the research here. So I just wanted to touch on this quickly. This is a definition of academic engagement that I personally like. So a student's willingness, need, desire, and compulsion to participate in and to be successful in the learning process. There are a few different types of academic engagement. There's behavioral engagement, which is the participate in piece of that definition. So studying, completing assignments, that's behavioral engagement. Are they willing to do the work that's needed to learn? Then there's also cognitive engagement, which is whether or not the student sees the work as an investment. So it's not only going through the motions of doing the work, but also having motivation to gain a true understanding of the material that you need to learn. And lastly, there's emotional academic engagement. This is the positive or negative feelings that the student has towards the academic experience. So basically, do they like school or not? That's their emotional engagement. All right, so how do all these pieces fit together today? As I mentioned, the links between substance use and academic behaviors are relatively well studied. But there are a few things that are missing from that research that I thought my study might be able to help fill. So first, many of those studies that exist already focus on only one substance at a time. So it'll look at just alcohol use in academics or just marijuana at academics. There aren't nearly as many studies that look at abstinence from all substances together. Secondly, academic engagement is not as well studied as an outcome as some of those specific behaviors that I mentioned, like skipping class or spending time studying. So my research question is, how does abstinence relate to academic behaviors and academic engagements? So specifically, I compared skipping school, grades, and academic engagement among 3 different groups of adolescents. So first we had our lifetime non-users. Those are the abstainer groups. So high school seniors who have never tried any substances by that point in their life. Next, we had our former users group. These were adolescents who had tried a substance before, earlier in their lifetime, but during their senior year of high school, they hadn't used any substances then. So they're our former users. And then lastly, we have our past year users. So these were adolescents who had used at least one substance during the past year. Right, so for this study, I used data from Monitoring the Future, which is the same study, larger study that I mentioned earlier. This is an annual survey of 8th, 10th, and 12th graders. It's a national study, so it's considered to be representative of adolescents in the United States. It's been run by researchers at the University of Michigan since 1976. But for these analyses, I used data from 2015, which was the most recent year of data that were available to me when I did these analyses. I also chose to focus on 12th graders because the academic variables that I needed were only available in the 12th grade survey. So using the 2015 data for 12th graders, that left me with a sample of about 9,600 students to look at. So for substance use, I categorized the adolescents into those three groups that I just mentioned before: lifetime non-users, former users, and past year users. And categorizing them was based on their responses to 14 different substance use questions. So they were asked about their lifetime and past year use of the 14 substances that you see on your screen. So I'd just like to note that includes both illicit drugs as well as the non-medical use of some prescription drugs. So those last four, the stimulants, narcotics, sedatives, and tranquilizers, that was specifically non-medical use. For academic variables, I had two key outcomes that I looked at. First, for skipping school, the students were asked how often they had skipped school during the past 4 weeks. I categorized them into two different groups: students who had skipped school at least once during that time frame, and then students who did not skip school. Similarly, I categorized the students into two groups based on their grades. So for this question, they were asked about their average grades so far in high school, and I split these responses as C+ or lower, and then B- or higher. All right, for academic engagement, there was a little bit more work involved here. So when I looked through the academic items that were in the survey, there were 7 that stuck out to me as being measures of academic engagement. So we decided that those 7 items, between the 7 of them, were really measuring 2 different things. First, there was the academic self-efficacy, which is how confident the student was in their academic abilities. And there were the 2 items listed there that measured that. Second, there were items that assessed their emotional academic engagement. As I mentioned a few slides ago, that is the positive or negative feelings that they have towards school. And there were 5 items that measured that. For each of those 2 topics, I used their responses to compute a score from 1 to 5. Higher scores meant that they had greater self-efficacy or had more positive feelings towards school. All right, and then I also had some control variables as well. So these are characteristics that we know are related to either substance use or academic outcomes, or both. And in this study, we wanted to remove the effects that these characteristics might have on the results. So they were included in these statistical analyses as what we call control variables. If anyone is interested in the statistics behind this, I did regression modeling, some logistic and some linear, and I did 4 separate models, one each for skipping school, grades, academic self-efficacy score, and the emotional academic engagement score. And the control variables were included in each model. All right, so drum roll, these are our results. So first, when I categorized the students into those 3 substance use groups, we found that 29% of these high school seniors had completely abstained from substance use up until this point in their lives. 63%, the largest group, had used at least one substance during the past year. And then our smallest group at 8% were those former users who had used something at some point earlier on, but not during the past year. So we examined the demographic differences between those groups to see if there are any characteristics that stood out. There were not any differences by gender or age. However, there were several groups that were overrepresented among the lifetime non-users. So that means the adolescents were more likely to be lifetime non-users if they had a parent with a college degree or higher, or if they didn't work during the school year. There were also some interesting regional differences. Lifetime non-use was more prevalent among adolescents in the Southeast United States, whereas past year use was more prevalent among students in the Western United States. And then lastly, students in college preparatory programs were more likely to be abstainers compared with students in general high school or vocational programs. All right, and then this slide is a bit of a webinar bonus for everyone joining us here today. These data aren't actually presented in the article, but it was something I thought was interesting, so I wanted to share. So this is looking at lifetime use by substance among that former user group, so that 8% of our sample. I was curious, we thought of this group as our experimenters, adolescents who had maybe experimented with the substance and then for whatever reason decided to stop using. Maybe they didn't like the feeling, they had a negative experience, maybe they could even be in recovery from more serious substance use problems. But I was curious to know what substances they were experimenting with. So that's what this figure shows. Probably nothing too surprising to anyone who's familiar with adolescent substance use, but alcohol was the most prevalent, followed by cigarettes and marijuana. The use of other substances was not very common among this group. The percentages are pretty low. All right, and then next we have another bonus as well. This is also not in the paper, but I thought you might want to know. This is lifetime use among those past year users. So here again, we have the big three at the top with alcohol, marijuana, and cigarettes showing up as being the most prevalent among these adolescents. You can also see the use of other drugs is slightly higher here than it was among the former user group. And interestingly, after those big three, alcohol, marijuana, cigarettes, the next four most prevalent are all the non-medical use of prescription drugs. All right, so how does this relate to our academic variables? Well, this is what we found. First, over here, we have the relationship between our three groups and then skipping school. So this is the percentage who had skipped at least one day of school during the past 4 weeks. And you can see that the percent who skipped school was about twice as high for past year users as it was for lifetime non-users, with that former user group right in the middle. Similarly, for grades, we found another, what we call a stair-step pattern in the results. So we found that the percent who got lower grades was about 1.5 times greater for past year users than it was for lifetime non-users. All right, and then for our academic engagement scores, there are some differences here as well. For academic self-efficacy here on the left, it's interesting to note that all the scores are pretty high here. It looks like most high school seniors are pretty confident in their academic capabilities, which I think is a good thing. If you see here, there is a small difference between our lifetime non-users at 4.75 and then our past year users at 4.69. Statistically speaking, that is what we call a significant difference. So the statistics are telling us that there is truly a difference in the scores between those two groups. But since they are both so high, I'm not sure if that's necessarily a practical difference or meaningful difference in academic self-efficacy. It looks like all students are feeling pretty confident. But if you look on the right side of the screen, we have our emotional academic engagement scores. First of all, the scores are noticeably lower here, so I think we can conclude that not everyone is enjoying school as much. And then the difference here as well between our lifetime non-users and the past year users is also more notable. So emotional academic engagement is higher among our lifetime non-users. And again, as always, we have our former users group right there in the middle. All right, so where does this leave us? What can we learn from this? All right, so first, I think it's important to know that a sizable minority of high school seniors have never used substances in their lifetime. Sometimes in the research world, I know we're guilty of maybe getting too focused on the adolescents who are using substances. We talk so much about screening and identifying students and how to intervene with them. And that work is so important. But I think this is a reminder that it's equally important to focus on promoting abstinence. How can we promote abstinence among this group who have chosen not to use anything? I'm curious to know if anyone who works in the community feels the same way. Do you feel like there's maybe lack of focus on promoting abstinence as compared to intervening to prevent substance use that's already happened? But from a research perspective, I think we can probably all do a better job at understanding those group of kids who choose to abstain from substance use. So for example, future research I would love to do would be some more qualitative work to speak with those students and understand what their reasons are for not using and how we can support them in that decision. It's also important to note that there is a small, not negligible, but small group of high school seniors who have stopped using substances. Some conversations about adolescent substance use emphasize the experimenting type of substance use. I think it's important to note that persistence in substance use is more common than cessation. So the group of students who had stopped using was quite small compared with the percentage of students who were still using substances. Unfortunately, using these data, we weren't able to determine their reasons for stopping substance use. But again, I think that would be a really interesting direction for future research. All right, in terms of substance use and academics, our findings suggest that students who abstain from substance use might experience better academic outcomes than students who are actively engaged in substance use. This is in line with previous evidence looking at substance use and poor academic performance. But the key here, the relatively new finding, is that academic engagement appears to differ between substance users and non-users as well. These findings also fit well within the context of the problem behavior theory. So that theory suggests that problem behaviors tend to cluster together, and it's more due to a general tendency to avoid pro-social or conventional behavior. So specific to this research, skipping school and substance use might be clustered together among adolescents as a result of a general tendency towards problematic or non-conventional behavior. All right, as with all research, there are some limitations here that I'd like to acknowledge. First, we cannot assume that there is a causal relationship between substance use and academics. So unfortunately, that chicken or egg question will live on for another day. Second, the survey is all self-report data. So there is always a chance that those data might be biased. Students could not want to provide information about substance use for fear of getting in trouble. And others might make up substance use because, I don't know, sometimes I think they think it's funny to do that. From my experience, kids do tend to be pretty honest on surveys like this, but there is always a chance of bias in the self-report responses. All right, and third, this is a school-based survey, so the data is not captured for students who either were absent that day, for example, truant students, or also for students who have dropped out of school by their senior year. However, from this research and other research as well, we know that adolescent substance users are more likely than non-users to skip school and to drop out of high school. For that reason, the results might actually underestimate substance use among this age group, and therefore also underestimate the influence that substance use has on academic outcomes and academic engagement. In terms of the implications, first, I think these results support the fact that more resources are needed for school-based substance use prevention programs. A school's main mission is the academic success of its students, and this research supports that preventing substance use contributes to that academic success. This isn't probably an audience that I need to convince of that, but if you're ever in a position where you need to make that case to policymakers or others who control funding decisions, please consider the role that research like this can play in supporting your case, really just emphasizing that link between substance use and academic success. Second, it is important that teachers, school administrators, and school health professionals, and even everyone working with adolescents in the community, work together to coordinate their messages around substance use. So consistency between the messaging can really strengthen the message. Also, coordinating within and among schools to ensure that policies are implemented consistently will help deter students from engaging in substance use. Next, we can consider ways to provide ongoing training to teachers and other education professionals for identifying early warning signs of a substance use problem. Of course, it is the best situation if we can prevent students from ever starting to use substances. But unfortunately, since that's not always the case, the next best thing is to identify and intervene with at-risk students at the earliest point possible before the problems escalate. So helping teachers play a role in that intervention process can be really important. Some schools have also even started using screening tools for substance use problems in their school-based health centers, and that's another option to consider as well. Great. Next, it's helpful for schools to develop relationships with community-based resources and local healthcare professionals who specialize in treatment or care for adolescents with substance use problems. That way, if an adolescent is experimenting problems with substance use, and either the student or their family needs those resources, it's helpful for the school to know where to refer them. Intervening with student users should not be seen as a punishment. We don't want to think of intervening as a way for students to get in trouble. It's really a way of putting students back on track towards their personal and professional goals. Sometimes educational professionals or schools might be hesitant to get more involved in preventing or intervening with substance use. But as I mentioned earlier, emphasizing the role that plays in promoting academic and personal success can really be a key message for rallying more support. We all share a common goal, and that is helping these adolescents stay on track towards their personal and professional goals. Right, these findings can also be adapted for messaging to parents. In my work, we've encountered some groups of parents that are more permissive towards substance use among their children. Again, for these groups, emphasizing the role that abstinence plays in academic success could be a hook to get the attention of parents. At this point, I also did want to mention another related resource that my colleagues and I have developed. So this is a website that was designed for parents of college students, although I think it could also be helpful for parents of middle or high schoolers as well. The website gives parents tips and tricks for communicating with their child, both in general and also specifically about substance use. So there are general tips and tricks for communication. And then there are also some scripts on the website for speaking about specific situations that can be associated with high-risk drinking. For example, holidays like Halloween or St. Patrick's Day. These scripts right now are all focused on alcohol, although a script for cannabis should be coming in the next month or so if you want to stay tuned for that. So the URL for the website is there, and you're welcome to visit the website or to share it with your communities if you think it might be helpful for them. All right, lastly, the connectedness or belonging that a student feels at school is a way to improve academic engagement and academic performance. So the stronger sense of belonging that a student feels is positively associated with academic outcomes. So therefore, I hope you consider increasing school connectedness as a way to prevent risk behaviors. If you're interested in ways to increase school connectedness, I wanted to highlight the strategy guide that was published by the CDC. It was a few years ago now, I think in 2015 it was published, but still as important and relevant today as it was then. So this guide outlines 6 evidence-based strategies that teachers, administrators, and parents can implement for increasing school connectedness. All right, so that's the end of my presentation. And before we get to questions, I just wanted to say thank you for joining us. And that also you can email me, my email address there, if you have any other questions that you'd like to ask outside of this webinar.
Great, and thank you for providing those 2 resources on the previous 2 slides. I just want to remind everyone that we are emailing out the slides to all of you participants, so you'll be able to access those links from the slides. Before we get into the question and answer session, I'd like to actually just read out a couple comments from participants regarding the focus or not focus on lifetime non-users among adolescents. As you mentioned, Brittany, there's not a lot of research focus on them, and I think community coalition members are agreeing that there's not a lot of community focus on that either. Nancy commented that there's absolutely not enough attention paid to lifetime non-users, and Lauren Gallegos wrote that our community is reactive rather than proactive. While we would like to promote abstinence, typically parents won't listen until their child is having issues. And Jessica Delgado agrees that the myth is perpetrated by adults who remember more drug and alcohol use in their own adolescence. So I thought those were great comments. And now we'll move into the question and answer session. So as a reminder, if you have any questions for Brittany Bugbee, please enter them in the Q&A box now while I get started with the CADCA questions. So first, I was really interested in your presentation when you mentioned former users as a distinct group from past year users and lifetime non-users. And particularly that former users do not have similar grades or I think academic engagement as lifetime non-users. Do you have any more information about this group and like why maybe they're not able to bounce back after their substance use?
Sure. So I agree that this is a really interesting group. When I was originally planning my thesis work, we actually kind of omitted this group. I think at the time we just didn't even realize that there would be this group that at a relatively early age, 17 or 18, had already stopped using substances. But there they are, and I think they're a fascinating group. So as I mentioned earlier, I wish there was more that we could learn about the group, but in this study specifically, we were limited based on the survey data that were available to us. So we have a few things that we do know about them. Demographically, they were more likely than the other groups to be a racial or ethnic minority group. Specifically, there was a greater proportion of Hispanic students in the former user group. They were also less likely than non-users to have a parent with a college degree. And they were also less likely than the other 2 groups to work during the school year. I thought it was interesting that the substances they use aren't all that different from students who are currently using substances. You still have alcohol at the top and then cigarettes or marijuana rounding out the big 3, as I called them earlier. So yeah, what stuck out to us in terms of their academic outcomes were that they were consistently in between the non-users and past year users. It was a very kind of stair-step relationship there. We interpreted this as a sign that academic performance improves after substance use has stopped. So maybe their academic performance was diminished before when they were actively using, but is better now that they were abstinent. There's some research to support that. There's a body of research looking at adolescents who went to treatment for substance use. And that research has found that their academic performance improves after treatment. So it's possible that this group maybe their academic performance wasn't permanently going to be lower than the past year users, or yeah, that they're, skipping school grades, all that would be permanently different than the lifetime non-users. It could just be that they were on the path to getting back to where they were before and they just aren't quite there yet. But I think there's still much more to learn about this group. So I personally really hope to do more research onto the details into understanding this group.
I'm going to jump in with a couple of questions about specifics in your presentation from the audience before I get into the second question from CADCA. So there's several people that are interested to know, does cigarettes in your list of substances include vaping, e-cigarettes, and kind of other tobacco product use, or is it just cigarettes?
So as a sign of how quickly things can change in the substance use world, since these data are from 2015, that was before vaping and some of those other products had picked up in popularity. So there were not questions in the survey asking about that yet. So that truly is just cigarettes.
Thank you. And then there's another question about when the survey is offered from Chris. Is the survey offered at the same time window during the school year across the nation? If so, what weeks or months during the year?
That's a great question. If I remember correctly, it is, I believe, during the fall every year. I don't think it's going to be exactly the same day for every school, but I do know that they do their best to make sure that the time frame is as consistent as they can make it.
Okay, just checking to see if there's any more similar questions to this. Someone asked where the study is conducted. I'm not sure if they mean like where is the survey being administered, or where are you doing your statistical analysis?
Well, I can answer both questions. So this study is run, so the larger study, the survey, Monitoring the Future, is run by researchers at the University of Michigan, but they do the survey at schools across the country. So they try to get a pretty big variety of regions that they reach, types of schools that they reach. So that's why the data are considered to be nationally representative. For me, myself, I was able to use their data because they make it publicly available. So I am at the University of Maryland, and I was also at the University of Maryland when I first used the data as a master's student.
And then I guess this is kind of an interesting question about how you chose to, there's kind of two questions on this, how you chose to categorize the students. Megan is wondering if you distinguish between levels of use, occasional versus chronic. And there's another question that's asking if it's possible that some students who reported substance use in the past year may have since stopped, and why not use 30-day use as opposed to past year use?
Sure. So for the first question, we did not distinguish between occasional or chronic use, mostly just for the simplicity of not having too many groups to compare. Sometimes if you split people up into too many groups, it just makes it a little wieldy and more difficult to interpret the results. So we considered everyone who had occasional or chronic use to be in the same group. That was also because we really wanted to emphasize that abstainer group. So in our mind, it was looking at that abstainer group in comparison to everyone else, regardless of their level of use. But it would be interesting in the future to look at that, to differentiate between occasional or chronic use. I'm guessing that maybe those occasional users might be more similar to the former users, whereas the chronic users would be a little bit more on the extreme. But that would be interesting to look into. And in terms of the past year or past 30-day use, I think it was kind of a similar idea, was that we really wanted to focus on people who had never used in their lifetime. And so to us, as a comparison, it was better to look at past year users as the comparison. Whether they had used during the past 30 days or used during the past year, they still weren't lifetime abstainers. So we went ahead and just used the past year use. If I remember correctly, it was also partially a data-driven decision because the data were slightly more complete for past year users. So that meant we had to throw out fewer cases because of missing data.
Thank you. We have a few more questions I'm going to ask about just kind of technical things related to the survey, and then I'm going to get back to questions from CADCA. We have one question: can a school district request that they be a part of the Monitoring the Future study?
That's an interesting question that I don't actually know the answer to that. But if you search for Monitoring the Future, they do have a website that has some contact information on it. So I suppose that you could reach out to them and ask, but that's a great question. I don't know if you're able to request that.
I tend to think that you wouldn't be able to, just because I'm sure that they're trying to get as random of a sample as possible and therefore wouldn't want to take volunteers.
Yeah,
but
I'm not sure
I don't know for sure either.
Would fit into that. I know they have, you know, kind of a whole structure of how they select the schools that are participating. So yeah, I'm not sure how, if volunteers at all would fit into that procedure.
Okay, one more. Why not use 10th grade instead of seniors to help with the problem of there being dropouts by senior year?
Partially because there is a bit of a spike in substance use between 10th and 12th grades. So again, because we were focusing so much on that abstinence group, that was the group that we were initially most interested in. We thought that people who had still abstained all the way into 12th grade were probably going to be a little bit different than people who had abstained only up until 10th grade. Just because those years in between are such big years for the initiation of substance use. So maybe people who had abstained all the way through 12th grade were, I don't know how to word this, but kind of stronger in their commitment to abstaining, which was an interesting behavior that we wanted to look at.
That's very interesting. That makes sense that there is a lot more. There's an increase between 10th and 12th grade, and you would want to capture that.
Mm-hmm. Yep.
All right, I'm transitioning back to the second question from CADCA. What strategies can community coalitions implement to reduce substance use and also encourage higher academic engagement and performance among students in their schools? And how can coalitions best work with those schools to accomplish their goals?
Right, so in terms of working with the schools, I think one option is always, again, to emphasize the role that substance use prevention can play in academic success. At the end of the day, community coalitions and the schools have that same overarching goal. You want to support adolescents in their personal success. You know, and I think that's why a lot of you probably are already working successfully with the schools. You have that shared goal. But if maybe sometimes that shared goal isn't enough, you know, working with the schools to really help them understand how substance use prevention plays a key role in promoting academic success can be really important. In terms of strategies to implement, I think community coalitions can play a role in many of the things I just mentioned. So for example, I mentioned training for teachers on the early warning signs of a substance use problem. Maybe that training is something that the community coalitions could help facilitate. But I also wanted to emphasize, again, I think a really crucial piece here is fostering that feeling of school connectedness. Keeping them engaged in school is really essential, again, both for their academic success, for preventing substance use, and just for their overall personal success. So I really do encourage you to read through that CDC strategy guide that I showed earlier. It was it wasn't written specifically with community organizations in mind. I think it was tailored a little bit more towards educational professionals. But I do think there are ways for community organizations to get involved in the strategies that are described by the guide. So for example, one important component of school connectedness is feeling really supported and cared about by the adults at the school. In the realm of substance use prevention, part of that could be helping teachers and administrators know what to do when a student needs help. How do you speak with that student about substance use in a way that doesn't make it feel like a punishment and lets the student know that you care about them? So maybe a training on communicating effectively about substance use is something that your organizations could help with. I also mentioned earlier the coordination of substance use prevention messaging. If your organization is putting messaging out into the community, maybe something like a social marketing campaign, check to see how that compares to the messaging that the students receive at school. So for example, if your organization or the school, one of you takes more of a harm reduction focused approach, and then the other is taking a very zero tolerance approach, both of those messages could possibly be less effective because they're discordant with each other. So coordination of messaging like that between the schools, between the community organizations could be really helpful. So I encourage you to think through things like that.
And then to follow on that, where can interested coalition members find more information about your work? I believe it's in the slides.
Yep.
There's a website, so previous slide to this. And what resources besides the two that you have already linked in this presentation can you recommend for coalitions interested in working with schools to reduce youth substance use in their communities?
Sure. So first, as Carolina said, the link to my center's website is provided in the slides. But just in case anyone's curious, our work focuses on substance use among college students, but we also work with other age groups and other health topics as well. So if you'd like to take a peek at some of the things we work at, you can visit that website. Or again, you're also always welcome to email me. And in terms of other resources, one thing that comes to mind is the Journal of School Health, not just because they published my paper, although I am grateful for that. But most of the articles in that journal, a lot of them are written by researchers, but also a lot of them are written by school health professionals. And every article is required to have an implications for school health section. There are quite a few articles on substance use. And even if it isn't maybe directly applicable to your work, I think sometimes just learning about how school health professionals think about substance use might be something helpful for you. So if you're interested, I encourage you to go read some of those other articles on substance use that you can find in that journal. Let's see, I already mentioned that CDC guide. Again, I encourage you to read through that. One other thing is SAMHSA, the Substance Abuse and Mental Health Services Administration, also released guidance last year on addressing substance use concerns in schools. That guidance is focused pretty specifically on implementing screening and intervention programs within a school setting. So if you're interested in helping set up a program like that, I encourage you to read that SAMHSA guidance. Or even if you're just interested in helping to advocate for something like that, I encourage you to read through that. That might be helpful for you.
Great, now I'll move to some questions from the audience. So there's still time for anyone to add their question to the Q&A box. So feel free to do that while I start asking questions. There's an interesting question from Lindsay. Since you were using monitoring the future data from, I think, 2014 or 2015, do you think that the rise in vaping in recent years will affect that there's 29% of lifetime non-users? Like, do you think that number will be lower with the rise in vaping?
Yep. Yeah. So I was using 2015 data. So unfortunately, in the research world, you're always running slightly behind. And vaping is a relatively new phenomenon. So I think My guess, educated guess, I'd like to think, is that the vaping numbers probably would drive up the past year use if I included that. And I think it would probably maybe shrink that 29% that was in the lifetime non-use group, unfortunately. But it would be really interesting to repeat those analyses as the data become available in these next few years to see how that has changed things.
Another question sort of about the data from Taylor. Any insights as to why youth who did not have a job were more likely to be non-users according to this data? That seems incredibly unexpected as jobs increase responsibility and present as a protective factor.
Sure. So that was one topic that I did speak about with my coworkers the co-authors who helped write the paper. One idea we had is that that might be functioning a bit as a proxy of socioeconomic status. The relationship between socioeconomic status and substance use in adolescence is kind of a complicated issue, but we are thinking that maybe there's a group of kids who come from a higher SES family, so they don't need to work. And you know, a higher SES family maybe is more likely to have a parent at home not working to increase parental monitoring. So I think it might be a function of their socioeconomic status.
And now we have a question from Tony. Do you have any data on how high school non-users or former users fare when they reach college and the substance use culture there? Any advice on how to prepare graduating seniors to deal with those social pressures?
Well, if you'd like to visit collegeparentsmatter.org, there are some scripts available on that website to help with students coming to college. But yes, I think one thing to really emphasize as much as you can is helping the students find a peer group that they fit into and that they don't feel pressured by. So, you know, encouraging them to participate in extracurriculars where they can find students who are, you know, have similar interests, similar lifestyles to them. I think that's really important. And just helping them feel really secure in their decisions and emphasizing that they know best what's for them. So if abstinence is best for them, just being really supportive in that decision. And then would you mind repeating the first part of that question?
Sure. It was just, do you have any data on how high school non-users or former users fare when they reach college and encounter the substance use culture?
Right. Sure. So I think sometimes some people are under the impression that if parents are really strict about non-use during school, or even students maybe are very academically driven, feel like they can't participate in substance use during high school, that they're going to get to college and go wild. The data really don't support that notion. So it looks like people who haven't had alcohol, marijuana, anything like that prior to coming to college are more likely to continue living that kind of lifestyle. There's a small handful of kids, but not a huge number, who come to college and their use really escalates from complete non-use to heavy use. That's just such a small minority of the sample. So in general, if you look at, you know, even by senior year of college, if you look at what substances people are using, how often they're using, what kinds of negative consequences they're experiencing, those students who are abstinent in high school are faring much better in the realm of substance use than people who had already used during high school. So yet another reason to really promote that abstinence during the high school years.
I just want to highlight a couple comments that were made in the chat. I think everyone can see them, but I'd like to highlight them from Erica and Sarah about why job use or having a job might be associated more so with substance use. Erica suggested that jobs may also expose teens to older teens and young adults and new social opportunities that could involve substance use. And Sarah pointed out that jobs could also mean that they are more financially independent and don't have to ask mom for $20 for beer. Parents have a harder time monitoring where the money goes when students have their own jobs.
Yes, those are both very good points, especially the financial independence, I think is probably an important piece of that puzzle.
All right, let's move on to a question from Erica. She asks, is harm reduction an appropriate message for teens? I have not seen evidence of that, although she agrees that punishment focus is not a priority.
Yes, this is a very complicated question, and I know there are strong feelings on both sides. I think for the younger audiences, the research really comes out on the side of supporting a more zero tolerance. I hate that term. Maybe we should instead say abstinence focused education versus the harm reduction. At the end of the day, it looks like adolescents who are exposed to that abstinence-focused education tend to fare better in terms of substance use through college than students, high school students who are exposed to more of a harm reduction approach. I think harm reduction becomes a bit more appropriate in college, but for high school, I think that's still a little too young for that kind of messaging.
Now let's go to a question from Tracy, circling back to the discussion of vaping as it relates to this data. As it is understood, there would more likely be an increase in nicotine or vaping use in more recent data from monitoring the future. Do you think the relationship between use and academic engagement would be different because it would be a different population of teens that vape rather than possibly using other substances?
Sure. So we definitely don't have an answer to that yet. Trying to keep up with the research, and it just don't really have an answer for that yet. I agree that vaping is a bit different than some of the other substance use. So it is possible that we're not going to see the same relationship there between vaping as well as vaping and academics as we do with, for example, marijuana and academics. But I think willingness to vaping might reflect more of an openness to engage in risk taking. And so it is possible that students who vape, if they become nicotine dependent especially, might be more likely to start smoking cigarettes. And then we know there's a relationship between smoking cigarettes and marijuana use. So it's possible that vaping could open the door to other kinds of substance use, and then we would see a relationship between academic performance and vaping. But directly from vaping and academic performance, I don't think the relationship is as strong there as it is with other substances.
All right, if anyone else has questions, feel free to add them in now. We're gonna wrap up the question and answer pretty soon here. So if you have a burning question, please add it now. A question for Christina. Is it possible to get information from young adults ages 18 to 35 who would have fit into the former user category to give reference about how or why they made those changes to become a former user by age 17 or 18? I do think that would be an interesting study.
Yes, I would love to do something like that. Some research like that. Yeah, I think that would be really interesting. I know specific to monitoring the future, they do some follow-ups actually through even later adulthood. They follow up some of their samples for a long time. Using that follow-up data, I don't think it would be possible, but to design a new study looking at that issue, asking slightly older groups to reflect back on their substance use like that, I would love to do something like that.
Well, if you do, we'll ask you to come back to this webinar series and present on it.
I would love that.
One more comment from Nancy. Many communities with high-performing schools have significantly higher substance use, enough so that being in a high-performing, high-stakes school environment is now considered a risk factor for youth use. She says, I know there are some studies, but think there need to be more to look at how this plays out in the population. So kind of what do you think about that?
So that's interesting because I guess maybe it depends on what exactly you mean by a high performing school, but we found, you know, some of the more higher performing schools in this study that was associated with abstinence. So it might also be a regional thing. Again, I think there's probably a bit of a socioeconomic status factor playing in here. Again, it's a very complicated issue. That could be its own webinar. But it's possible that these higher performing schools are in higher SES areas, that sometimes in some higher SES communities, there tend to be more permissive attitudes towards substance use. That could be a piece of it.
All right, we're gonna wrap up the webinar. So please keep an eye on your email for information about the next webinar in this series. We haven't set it yet, but some topics we're looking at are suicide prevention and also alternative pricing strategies for tobacco control, and those will be possible topics. And if you have ideas about topics, you're welcome to email me your thoughts, and I will definitely look into it, although I can't promise anything on any topics you suggest. As I mentioned earlier, I'll distribute the slides to everyone who participated, and I'll also distribute the link to download Ms. Bugbee's article, and the slides will also have the links to the resources she mentioned. That email is also going to contain a short evaluation for this webinar, so please fill it out if you would like a letter of participation. Once you hit submit on the evaluation, you'll be directed to a thank you page, and from that page, you'll be redirected to the letter of participation, and you should download it immediately when you see it there, because you won't be able to get back to that thank you page if you close your browser. But that's how you can get the letter, so if you want a letter, please fill out the evaluation. This email will likely go out tomorrow, so look for it then. I'll also be posting the recording of this webinar and the resources mentioned in the presentation on the CADCA website in the next week or so, hopefully by the end of this week though. And now CADCA would like to thank Brittany Bugbee for the wonderful presentation on her work and for her commitment to providing relevant and current material regarding youth substance use. And thank you to all of the webinar participants for your comments, questions, and insights. Stay safe and healthy during the pandemic.